Hey guys, it's Matt the Bowtie Guy. Today we're going to talk about COVID-19 and how that's going to impact your Thanksgiving plans and the new COVID vaccines and what you need to know about them as of today. All right, let's talk about it. Alright guys, so before we get started, make sure you click on the subscribe button below, share this with all your family and friends, hit that like button, and also check out my blog and website at bowtiehealth.org. Alright guys, this week is Thanksgiving. For me, I've been battling with a lot of frustrations, a lot of discouragement, and some hope. Let's talk about the holidays first and why I'm feeling the way I'm feeling. As of right now, the country is not doing well at all in regards to the COVID-19 pandemic. As you know, numbers are on the rise. And this isn't just here, there, over here, small cases, maybe a little bit bump in here, a little spike here, smoldering embers, however you want to call that. This is a full-blown outbreak. The entire country is seeing a surge in cases. We've surpassed 200,000 cases in a single day. That's unbelievable. It's scary, actually. We're surpassing 2,000 deaths per day. Our hospitalizations are over 80,000 right now in the country. ICU admissions are climbing. Ventilator admissions are climbing. It's not a good thing. We are in a very bad place right now, and it's only getting worse. What does this have to do with Thanksgiving? Well, obviously, people want to celebrate a holiday where we gather indoors and share a meal together. For me, it's one of my favorite holidays. I love spending time with my whole family, seeing everyone, eating amazing food, having some laughs, and doing our usual Thanksgiving traditions. And I'm sure all of you do as well. However, TSA reported on Friday, this past Friday, on November 20th, that they saw over 1 million people traveling across the country for the holidays. That scares the living crap out of me. And the reason being is you don't know if you're carrying this virus. Over 50% of people are asymptomatic or pre-symptomatic carriers, meaning they feel great, they feel fine, they likely they weren't aware that they were exposed, and now they're going to pass this on to a room full of loved ones, people they care about, unknowingly. This is a problem. If we're already seeing over 200,000 cases a day, that could spike even higher after these holidays. Our total deaths have exceeded 250,000, unfortunately. That's a problem. So why isn't it a good idea? Well, if you think about it, it's not a good idea because testing is inaccurate, you don't know if you've been exposed, and you're going to be congregating with a group of people likely in an enclosed space because most places it's cold and you really couldn't do it outside. That is not a good thing to do. Let's talk about testing first. So right now, cases are skyrocketing. Therefore, testing is increasing. We still don't have enough testing done. Unfortunately, the federal government has failed to set up a good response when it comes to testing, and we are not doing as much as we should be, and our turnaround times are slowing down again because the demand is so high. Having said that, you have a lot of people who now want to travel for Thanksgiving, and they think it's a good idea to get tested before they go see their family. That's going to slow it down even more. If you start getting your test results 7 days or later, it does you no good whatsoever. And so that's a problem. The other thing is you're taking a test away from someone who potentially needs it. A healthcare worker who is potentially exposed and wants to make sure they don't have it so that they can go back to work to help keep taking care of other people. You have someone who may have symptoms who wants to get tested. Not enough to be sick and go into the hospital, but sick enough that they should get tested so they themselves can quarantine to make sure it's not COVID. If it is, they have to quarantine. If not, they might be able to get treatment of other kind. Let's talk about the test itself. False negatives are really common with our current testing. On the first day of testing after exposure, if you're going to test someone on day one after they've been exposed, so 24 hours later, someone coughs and they have COVID and you're around them, you have a false negative rate of almost 70%. I think it's around 67%. If you're at day 4 after exposure, that's about 40% around there, maybe a little higher. And around day 5, it's slightly lower. And that's usually when most people have symptoms on average is around day 5. That's a problem. If, you have a 40% chance of possibly having it and you get a negative result, that can give you a false sense of security. That's a big problem. If you're going to go travel across the country at an airport, you may have had an exposure, you get tested, 4 days or so after, get tested, you get a negative result, you're all happy as can be, you can go see your family, you don't think it's a risk, you might feel more comfortable to give your mom that hug or your grandfather that hug or, whatever it may be. That is going to cause problems. You're going to start spreading the virus even more so than you would if you didn't get tested because you're at least going to be a little bit more cautious about it. So testing is not the greatest idea as a prophylactic move to try and think that things are going to be safe. You can't have your whole family test before they come. It might give some hope and you might actually get some true negatives, but there's a likelihood that you're going to get some false negatives as well. And then that could create a false sense of security, maybe not in yourself. Maybe you yourself have taken the appropriate precautions and you've been quarantining for a while and you have absolutely no exposure with anyone and you get tested and it's negative. That could be a true negative. But you don't know if your uncle, your brother, your sister, your mom, your dad, someone may have had an exposure, they get tested, they may not take the same precautions as you, and they get a false negative, and they may feel more apt to give someone that hug, that kiss, that whatever. That could potentially spread the virus to your family members and your loved ones. So that's my concern when it comes to Thanksgiving. You're going to be in a small area with a lot of people eating unmasked, likely indoors because just the weather in most places right now is really cold, and if it's inclement weather like raining or snow in some places, definitely going to be indoors, and your risk is going to be higher. So please take that into consideration. Now, if you decide to do Thanksgiving with your family, everyone's taking the appropriate precautions, you want to make sure this is as safe as possible, how can you do that? Okay, so you can open your windows, get things ventilated, have the air circulating and moving quickly all the time. Turn on a fan, open all the windows, get things moving around. Have everyone wear masks the entire time and only remove them to eat. And when you see people, seat them at least 10 feet apart if you can. Have them in different sections of the house or the room if you can. Be safe about it. And then, of course, have everyone sanitize, their own plates. Make sure everyone washes their hands. And, if someone's not feeling great, have them not come. I know it's discouraging, but do that. Just be safe. I'm not celebrating Thanksgiving with my family this year. It's the first time ever in my entire life. It stinks. I love Thanksgiving. We have our own family traditions, great food and plenty of laughs. And, I miss my family. I haven't seen them in months, but I'm trying to be safe. I've seen patients and I've had, potential exposures. And so I'm trying to do the right thing by keeping them safe. And so I hope you do too. So that's my spiel on Thanksgiving. I don't want to dive any more into it. I don't want to be a negative Nancy, but as a medical professional, having seen patients, having helped develop a COVID-19 clinical response program, I want to make sure that I'm at least putting information out there to make you think about this critically and to make sure you're doing the right thing. Okay. Now, there's a lot of talk about the COVID-19 vaccines. And this is really exciting. And I wanted to rope this in because there's been a lot of announcements lately, and I want to make sure that you have the information you need to make the right choice. Now, I've done a video prior to this about the COVID vaccines and whether or not I would take them. Like I said, the data has to be there. It has to be safe, has to be effective. The benefits have to outweigh the risks. As of right now, they are very promising. And I will likely get the vaccine based on what I know right now. So unless something new comes out that shows that it's not that safe, then I won't take it, but I'm going to take it. Things are looking promising. Currently, there's 2 vaccines that are really at the forefront of this. There's another one, the Oxford AstraZeneca vaccine, which is about 70% effective, but, with some dose adjustments, they can achieve 90% effectiveness. But let's talk about Pfizer and Moderna, and those are the mRNA vaccines. Definitely check out my COVID-19 vaccine video for more information. I kind of get into detail about what that is. But just as a quick reminder, mRNA vaccines are brand new. We've never used them before, but don't let that scare you. We've known about mRNA for decades. We know this inside and out, how the body, uses it to make proteins. And in this case, Moderna and Pfizer have cracked the code in getting that mRNA into a cell, creating a protein that resembles an antigen or a spike protein from the coronavirus, so that our immune system sees it, creates an immune response like any other vaccine, but safely, and it does so with a great efficacy of almost 95%. The downside to these two vaccines is that the Pfizer vaccine needs to be held at sub-zero temperatures. So it's about minus 60 or 70 degrees Fahrenheit. That's cold. That's going to be really hard to store and to distribute to maintain a cold chain, making sure it doesn't go above that temperature and the vaccines don't go bad. The good thing about Moderna is you can store it regularly for 30 days in a fridge. That's huge. Now, let's talk about some concerns people have been raising to me and asking my opinion on regarding the safety of these vaccines. First and foremost, these are safe. Despite government pushes and a lot of politicization and partisanship regarding a lot of FDA, CDC guidelines, things that have been pushed out during this pandemic, I've gained a lot more confidence in reading some of the scientific literature about these vaccines and the process that's been going on behind them. Currently, Pfizer is submitting for an emergency use authorization for their vaccine. Moderna is surely to follow very soon. And so they'll go through a very scrutinizing process of the safety of these vaccines and the efficacy to make sure the science is sound and that this is something that we can absolutely give to the general public to make sure that it's safe, it's effective, and it's not going to cause any problems and hopefully stop this pandemic. Now, why do I feel so confident about its safety? One big concern that a lot of people have is, these vaccines came out really fast, so they feel like they were rushed through a process that normally takes anywhere from 6 to 11 or sometimes 14 years. That concerned me, right? Here's the lowdown on that. Vaccines, for the longest time, to figure out what we need to use to make the vaccine work and be effective and create an immune response takes a long time. In this case, it took only 2 months to figure that out, to figure out what protein would work and how to work this technology. And this technology has already existed, but it needs to be refined. The other part is we had the entire world focusing every research and effort to figure this out, right? It was a race to get an answer to stop this because it wasn't just the US that was affected, it was the entire world. So you have world-renowned researchers and scientists from the entire globe looking into this. So what normally takes 5 to 6 years, usually the longest part of the vaccine process, we did it in 2 months. And the fact that, it happened so quickly is because we have advanced technology that didn't exist before. We were able to use technologies that sped up the process. And so that is very, hopeful because you can create something very quickly with some of these newer technologies and do it just as safely and efficiently as you did before with previous vaccines. Now, what about the safety data? So we know that vaccines, almost, I think 97 or 98% of serious vaccine side effects occur within the first 40 days of administration of the vaccine. So we know that. Long-term wise, it's very rare that a vaccine will have a long-term effect. Very rare. So obviously we can't have long-term safety data because it's not even out yet. We need to see how we can monitor these things for years and years and years. That doesn't mean it's not going to happen. The CDC has already said it's going to monitor every vaccine administration event that occurs for long-term safety data once it's been released into the public and being administered to people. The good thing is normally it's required to have 40 days of safety data. We are so lucky that these vaccine manufacturers have actually increased that time span to ensure utter safety to 60 days. So they're looking at these patients even longer than what's normally done for most vaccines. And with Moderna and Pfizer's, there's really been no major serious events maybe some aches, some headaches, and some fevers, but outside of that, they are very safe. And the best part is because you're using the body's natural mechanisms to use that mRNA, make the protein, and trigger your immune system so that it requires the protein and says, uh-oh, this virus is here, I'm going to kill it. And it protects you in that way. Now, do we know how long we're going to be immune for against SARS-CoV-2, the coronavirus that we're experiencing? We don't know. But it'll at least help stop this pandemic in the short term while research catches up and we can monitor its mutation levels in the general public. And this way we can develop new vaccines going forward like we do the flu vaccines. The fact that these vaccines are 95% effective is mind-blowing. To get that number is insane for a vaccine. As we know, the flu vaccine is usually anywhere from 25 to 60% if we're lucky. And that's because we have to guess the strains based on mutation patterns and what's been circulating. So I am very happy to see that these vaccines are coming out. You know, we might have them by next month. In a couple weeks, they could start distributing them. You know, the ACIP, which is kind of the immunization body that gives recommendations on administration of vaccines, they're going to come up with guidance. They're actually meeting as we speak since Pfizer has submitted their emergency use authorization form, and they're looking to figure out who gets this first and in what steps. Likely it'll be healthcare workers first, then first responders, and then those in nursing homes who are high risk, things like that. And then they'll slowly gradate into essential workers and then the general public. The reason why healthcare workers are likely going to get first is because we have the most exposure. We're going to be seeing these patients. And, you know, just like in an airplane, when the mask pops down, you got to help yourself first before you can help others. So if we don't protect our healthcare workers and they all get sick, there's no one to take care of everyone else, and that's a recipe for disaster. So that's it, guys. You know, I want to give a brief talk on the vaccines, how to have a safe Thanksgiving, and, you know, to make you really think about, do you really need to travel? Should you travel right now? And also testing. You know, if you haven't had an exposure, if you haven't been told by your primary care provider to get tested, you know, if you're not symptomatic, it's probably not a good idea to get tested. You're going to take away a resource that's already limited from someone who may actually need it. So please, guys, think of everyone else around you. You know, we're all in this together. You know, we're all humans. We need to look out for one another, especially right now with what's going on. This is a dire time. You know, like I said, I don't want to be negative, but it's the reality of things. And if we don't change our actions, it's only going to get worse. So that's it for me, guys. I wish you all a happy, healthy Thanksgiving. Please be smart. Wear your mask. Wash your hands. Physically distance. And I'm Matt the Bowtie Guy, signing off. See you guys later.